Hi, I'm Dr. Rahel Nardos, Director of Global Women's Health at the Center for Global Health and Social Responsibility and Associate Professor in Urogynecology and Reconstructive Surgery at the University of Minnesota. In 2020, I moved from Oregon to Minnesota to take on my new leadership role soon after the start of the COVID pandemic, the death of George Floyd, and the brutal conflict in northern Ethiopia, where our major partners reside. This introduced many challenges, but also offered unique opportunities to build a more diverse community of practice and to tap the wisdom of communities for more innovative solutions around women's health. My leadership project involves building a simulation-based educational platform for safe cesarean section that can be easily accessed by healthcare professionals globally and can be incorporated into existing formal training programs, particularly in low and middle income countries. So why is this project important? In low resource settings like Ethiopia, where I grew up, there aren't enough residency trained obstetric gynecologists. Therefore, most C-sections are done by non-obstetricians who have had limited hands-on surgical training prior to independent practice. Although there's no replacement for bedside training, we can reinforce education with innovative virtual and in-person simulation training that creates a realistic and safe environment to practice both soft and hard skills in medicine. Why focus on C-section? A woman dies every 2 minutes from preventable pregnancy or childbirth-related complications, with nearly 99% of those deaths occurring in low and middle-income countries. Globally, more than 100,000 maternal deaths per year could be avoided with timely surgical intervention through safe C-section. But when C-section is not done safely, it can lead to higher rates of maternal mortality and morbidities such as infection, hemorrhage, injury, and anesthetic complications. For example, up to 24% of obstetric fistulas are caused during surgery. If we want to reduce maternal mortality and morbidity, we need to make C-section not just available, but also safe. As a surgeon and someone who has been a surgical patient, I know the following to be true. As a patient, you want to be seen and treated with respect and compassion. You want your healthcare team to communicate with each other and work well to reduce harm. You want a skilled team who not only know how to do the surgeries, but how to recognize and address complications when they do happen in a timely manner. Our project hopes to meet this basic patient needs that every pregnant woman has, no matter where she lives. We're creating immersive simulation-based mixed media educational content to allow surgical teams to learn in a safe environment where the stakes are low. Our approach is based on a community of practice where simulation scenarios and educational content are co-developed and piloted with our interprofessional team from our global partners in Ethiopia, Rwanda, and the United States. In phase 1 of our project, we're creating scenarios involved in obtaining informed consent. These scenarios focus on learning objectives such as ethics, cultural consideration, and patient-centered and compassionate communication. Phase 2 of this project, we will focus on more technical skills, focusing on surgical anatomy of a pregnant patient and a C-section procedural skills. To measure impact, we will perform baseline assessments of current practices in teamwork and communication and current C-section outcomes, and we will track improvement in a continuous feedback loop. Implementation and scale-up will be guided by our Community Advisory Board, which is made up of educators, policymakers, simulation and technology experts, and interprofessional frontline healthcare workers. In closing, this work and the WomenLift leadership training has helped me grow as an adaptive, inclusive, and strategic leader. My hope is that by showing the impact of our phase 1 educational modules, we can position ourselves for bigger funding to complete the second phase of our project and to implement and scale up. Ultimately, Our vision is to do our small part in ensuring that every pregnant woman has access to safe C-section no matter the lottery of her birth. Thank you.